I feel that the resident here should not have to perish for someone else's mistakes.
Access to health care is extraordinarily important to all citizens, particularly those in Gadsden County.
And with us, accident-prone children, it's going to happen a lot more than not.
My son was 30 years old. He had 4 children. He worked, he drove trucks. He took his children fishing just before he had the heart attack.
For Brenda Holt, not having a hospital in Gadsden County is a razor's edge, cutting at her bit by bit every day.
He had a malfunctioning valve in his heart.
The EMS team did all it could to revive him. They worked on him continuously all the way into Tallahassee. But the young man, father of 4, was ultimately a victim of time and distance. He's not alone. Gadsden County emergency teams operate at full capacity, more than 7,000 calls last year.
We had to purchase 2 new ambulances this year just to be able to keep up with the calls.
Ironically, every day, crews drive right past the Gadsden Community Hospital, which closed 3 years ago.
You know, we've got to look at the fact that many people have already died passing by this hospital trying to get over to Tallahassee.
Paramedics speak of the so-called golden hour, the 60 minutes immediately following an injury, heart attack, or stroke, when the chances of recovery are highest. Getting the patient to emergency care quickly is the goal. It takes approximately 45 minutes to get to Tallahassee from the middle of Gadsden County.
Time is critical. When you're having a crisis, a health crisis, paramedics, health professionals says that time is tissue. As time that goes by, if you're having a heart attack, you're losing tissue from your heart.
In the 3 years since the hospital shut down, Gadsden residents' only local source of emergency care has been the Urgent Care Center, operated by Tallahassee Memorial Hospital. Its hours and services very limited. With its population approaching 50,000, Gadsden County is a medically underserved community. About 25% of the population is uninsured or underinsured. Among the 32 practicing physicians in the county, there are no OB/GYNs. Infant mortality and the incidence of diabetes are twice the state average. And of the nearly 80 benchmarks Florida uses to measure citizen health and well-being, Gadsden County ranks last or next to last in 66% of the categories.
High infant mortality rate, high obesity. Basically they have some of the highest issues, health issues in the state.
Combine that with the constantly escalating cost of transporting medical cases from Gadsden to neighboring Leon or Jackson County, even when they're not dire emergencies, and the economic impact is every bit as serious as the existing health issues.
Well, it's going to save taxpayers dollars. Right now, we are spending over $2 million just in transportation going to the hospital through EMS. So I think that'll save taxpayers dollars, and I think, we're going to save lives.
It would make a big difference. We will be closer to a hospital. The people who aren't very sick but still have to go to Tallahassee, they could just go here. It's going to be more convenient, especially if they have small children who get sick.
If Gadsden voters approve the half-cent sales tax, they can reasonably expect the following. The half-cent sales tax would begin January 1st, 2009, and the hospital would open by Memorial Day, following a round of renovations. The hospital will have a 24-hour emergency room, 25 beds, and a clinic with radiology and pharmacy services. Approximately 45 to 72 new jobs will be created, each with an average salary of $20 an hour. The hospital will be under local control. The 8-member board of Gadsden Hospital Incorporated will be responsible for oversight. Administration and staff will be subject to approval by the Board of County Commissioners. The money collected from the half-cent sales tax will be collected by the Florida Department of Revenue and transferred to the Gadsden County Clerk every month. The Gadsden Community Health Council will oversee the spending, and quarterly reports will be issued.
I plan to tell my congregation that we have a choice. We have a choice in all that we do. And all of our choices are, have repercussions or benefits.
If the half-cent sales tax is defeated, it's possible the Gadsden Community Hospital could close forever, and the Urgent Care Center, in all likelihood, will also close its doors. The existing hospital license will expire in June 2009. Trying to relicense the hospital would be more expensive and cost taxpayers more than the half-cent sales tax.
If we don't do it this time, it won't be a next time. This is it.